My name is Shannon Whited, and I'm going to be doing my assessment on my friend Melanie here. So before we got started, we did her vital signs such as blood pressure, temperature, respirations, heart rate, and we did a height and weight. So the general survey of the physical appearance of Melanie, and her build is normal. Her breathing state of awareness, I see, is normal, and her breathing is non-labored. She's aware of her surroundings. Behavior is normal. She seems calm. Speech is normal and clear. We had a conversation before when she got here. And Mel is oriented ×4 to person, place, time, and situation. Melanie's body structure is normal. Built is normal, which includes that she is nourished. Facial expressions, it's okay, look at me, good. She's smiling, patient has good eye contact. Mobility, I saw her when she walked in, assessed her walking. She walked smooth with no issues. Her posture is good. She's sitting upright, and her gait was steady. So first thing I want to do is I want to check the skin and hair and nails. First I want to do is the color of her skin. So kind of just feeling that if it's warm or she has any cool spots. So checking everywhere. Okay. Next is the color. Her color is normal, it's pink. Next is turgor. So I would kind of go below the clavicle, pull up some skin. It should go back. You want to look for elasticity, promptly returning to place. This is that Mel is well hydrated. Skin is dry to touch, no flaking, no irritations. Hair distribution. So I want to look at her hair and her scalp. Make sure it's even. She has no nodules or any bumps, and her hair is well distributed. Okay, Mel, you can put your hair back up. Okay. Moles, want to check for moles. Melanie does not have any moles. See which I want to check for asymmetry, border, color, diameter, and evolving, which is any sort of change. So we already looked at her scalp. You want to look throughout her whole entire scalp. Look for any lesions. She did not have any. Nail color, she is wearing nail polish, but what I would do, I would check for capillary refill. Her nail color is pink. Well, now it's gray. So she has good perfusion. Her cap refill is good. She has no clubbing. Nails are smooth and firm. Okay, so the next I'll be doing the head, face, neck, eyes, and sinuses. So I want to look at her face and her head. She has good symmetry. Everything seems aligned. Next, I want to look at her sclera and her conjunctiva. Okay, sclera is white, conjunctiva is pink. Okay. Now pupil size. I do not have a pen light with the exact size, but what I can do, I'm going to check for direct accommodation. Okay, just look straight ahead. Okay. The round reactive. Neck carotid pulsus. So I want to feel the carotid on both sides. And also on here, I'm going to check for her trachea is midline. There's no deviation. Okay. Neck jugular vein distension. One way to do it is when the patient is laying down. You want to look to see if have the patient turn their head to the side and kind of look if there's any vein distension. Melanie does not. And then also when I was kind of looking at the trachea, you want to look at the thyroid, make sure it's midline, no swelling, no nodules. And also the sinuses. You want to check the sinuses above the eyebrows and down here too. Okay, that's normal. Okay. And another way to check the thyroid gland too is to have the patient swallow a sip of water and have their patient have their head back, swallow some water, and palpate those nodules as they sip, and it should return to normal. And then, so we're gonna do ear, nose, throat, and lymph nodes. So next I'm gonna look at her ear color. It is normal. The symmetry on both sides, it's symmetrical. Next I wanna look inside of her ear to see if there's any drainage, which there's not. Okay. And next I also want to look inside of her mouth. I want to look at the tongue and the oral pharynx. Okay, tongue out. Okay, her soft palate, teeth are intact. Gotta put your tongue in. Okay, put your tongue back out. Tongue up. Okay, everything is normal. And her lips are pink, not dry. There's no nodules. Her gums are pink as we looked inside of her mouth. No ulcerations inside of her mouth either. Mucosa is moist, and the throat and uvula is normal. So next we're going to check the lymph nodes, the anterior cervical and the posterior cervical. So anterior cervical is right above the clavicle here. And you want to check that for any nodules, and then in the back as well. Okay, nothing is abnormal. Okay, so next we're going to be listening to her lungs. Okay, you want to listen to her respirations, and they should be normal and non-labored. Do you take a deep breath in? No. Okay. Okay. Okay, and you also want to listen to the back as well. Okay, deep breath in and out. Okay, good. Okay. Okay, normal. Okay. Now I want to palpate the anterior posterior chest. You just want to make sure she has no nodules, no lumps, nothing that you can feel. And then back here as well. Put your hands around on both sides. Okay. She has no wheezing or rhonchi, no epiphantous breath sounds. So we palpated her anterior and posterior chest. So respiratory excursion, what I'm going to do is I'm going to go on the back, and I'm going to put my hands across her back here. And now I want you to take a deep breath in and out. Okay, so that is good. While we do that, the thumb should actually move equally apart when she inhales and exhales. So the next thing we're going to do, we're going to listen to her heart. And first the apical, pulmonary, and tricuspid, and then mitral. Okay. Okay, and then the pulmonary. Okay, and the tricuspid. I'm going to try on Mel here. And the mitral. Okay, good. Okay, so normal S1, love S2 dub, and then mitral S3, turn slightly to the left. So I would have her actually lean forward. Okay, lean a little forward, Mom, and put your arm up. Lean a little forward. Okay, so that is normal. Okay, next is pulses. So I want to, well, we'll listen to her carotid pulse. and there's no bruits. And next is her radial. Check on both sides. Okay, good. Okay. Brachial. Okay, and then femoral we're not gonna do. And then the popliteal is behind her knee. You can leave your arm laid down, yeah. Okay. That's good, good pulses. Okay, and then you have your posterior tibial. It's back here. Okay. That's good. And then your dorsalis pedis. Okay, good. So all of her pulses are really good. And she has no edema, no swelling, didn't notice anything. So the next thing I'm gonna do is her abdomen. So I'm not gonna have you lay down, you don't have to do that. I'm just gonna kind of listen to your all four quadrants. Okay. So first you want to inspect, and then listen, auscultate, and then do some palpation. So first I'm gonna listen. Okay. And then after that, we want to you want to check for any nodules in her belly. See if they're, light palpation is usually what we do for any tenderness or masses. And then you want to listen to bowel sounds in all four quadrants, which we did. And then you want to, and then percuss. So Melanie, would you like to lay down? And I'm just going to do this just to show how to percuss in all four quadrants. Not necessarily lifting up her shirt or doing that. So in all four quadrants, I'm going to kind of okay. And usually when you percuss too, you want to hear tympani is like dullness, air fluid, and then solid is usually over the liver. So while she's down, we're going to do some light palpation and deep palpation, just to feel any masses, anything like that in the abdomen, and then usually deep palpations as well. And you always want to make sure that they're not hurting anywhere. You won't do any deep palpation if they have any sore areas. The next thing I want to do is the liver edge too. I want to feel around the liver edge, which is here, and notice any masses or anything like that. And then also her spleen would be on this side. Okay, now you can sit up. And then you would want to list for any bruits when you auscultate, which we did. Okay, I guess I don't need this. All right, so the next thing we're going to do is musculoskeletal. So we're going to do the head and neck strength. So the first thing we're going to do, the head and neck, so you want to go up and down, okay, side to side, okay. And so the strength is, remember we went like this, go like this, right, make a fist like that. And I'm going to kind of pull, okay, hands on the knees. I want you to go up with your one knee, okay. Now I'm going to push down, okay, up with the other, okay, same thing, try to push me, okay, good. So now is the jaw, so I want to have you jaw forward, side to side, open and close, okay, good. Fingers, I want you to make a fist, okay, extend, okay, and start to abduct and adduct your fingers. Okay, good on both sides. Okay, wrist, I want you to make a fist, and I want you to resist me. Okay, good. And shoulders. Put your hands across your chest. Okay. No, just your one. Okay. Good. I want you to put the same arm. Try to touch your scapula. Okay. And then take your arm all the way down and go underneath and try to touch your scapula. Okay. Good on right side. On the left. Okay. And try to go scapula. And then down. Okay. Good. And then elbows, flexion, extension. Okay, good. And so what I want you to do is I want you to stand up. Okay, hips standing like this. I want you put your legs to out. Okay, and then do the same thing with the other side. Okay, and then have your leg forward bent like this. Okay, and down. Good. The other side. Down. Okay, and then leg backwards, which is your extensor. And then the other one. Okay, good. Your knees, flexion and extension. So you have flexion and then extension. Okay, good. The other side. Flexion, extension. Good. All right, now I'm gonna have you, actually no, we'll do the toes and toenails. We're actually gonna do the spine now since you're standing up. So what I'm gonna have you do is bend down, touch your hands to your toes. Now I'm looking at her back, making sure everything's okay. Good. Now I want you to stand up. Good curvature. Now I want you to lean backwards. Okay, and then side to side. Side to side. Okay, good. Now once are you able to walk 3 to 4 steps? Go this way, and then back. Okay, good. We also saw our gait in the beginning too. Muscle tone extremities are good. We already checked that. All right, now I'm gonna have you sit down again. Sorry. All right, to touch strength, we're gonna do your toes and toenails. Kind of flex up and down, wiggle your toes, both sides. Okay, good. Next is her balance is really good, as we saw. She's able to stand up, hold her balance. I do not have a hammer to check the reflexes, but what I could do, patellar reflex, do this on each side, and the response should be to come up. The ankle reflex is I would have my hand on the back here, and then I would hit in the back, and the normal response would be to bend down, like the toes would bend down would be a normal reflex. So do it on both sides, the toes would bend down. Next is the bicep tendon. So we would have our hand like this and use the hammer, hit here. Normal response is to flex up. And then the other one would be the tricep. I would have your arm like this, arm like that, and then arm on the side, and be the deep tendon reflex, and would hit it here. The normal response would be the arm would come out, and we would do that on both sides. The Babinski reflex, we would do that on her toes too, and the normal response would the toes would actually curl inward. All right, so hand drift, so arms out. Okay, next thing we're going to do is coordination, eyes closed. Put your hand to your nose. Okay, then left hand. Okay, that's good. And the motor strength, upper and lower, we actually kind of just went over that. Now sensory, you want to make sure that she can feel dull or sharp pain on both sides. So same on both sides? Mm-hmm. Same on both sides? Yeah. Same on both sides? Yeah. Okay. Dull? Mm-hmm. Okay. And this would be a sharp. Sorry. Same on both sides? Yes. Sharp or dull? Sharp. Okay. Okay. Sharp as well? Mm-hmm. Okay. Okay, I think that is it for that. All right, so next is the olfactory. So Cranial nerve number 1 is olfactory, so what I'm going to have her do is close her eyes, and I'm going to put something in front of her nose, and then she's going to tell me what she smells.
Pine.
Good. Pine. Next is the optic nerve, which is cranial nerve number 2. I'm going to have her do is, oh, 1 second. Okay, remember, cover up your right eye. I'm going to cover up my left. Remember, just look at my eye. Don't look at anything else. Don't look at my hands. I want you to tell me what you see.
2, 3.
Okay, so on this side. Now just look at my eye.
1, 2.
Okay, good. Okay. Then the next one is cranial nerve 3, 4, and 6 is the extraocular movements. So that one is the 6, that's the 6 cardinal gazes. So what we're gonna do, I want you to just look at this pen, swallow this pen. Okay, good. Okay. And with the pen light too, when we were doing that, you want to look for any involuntary shaking of the eye when we do that. So the cranial nerve 5 is the parotid. I'm going to have her clench her teeth. Clench her teeth. Okay. Okay. Keep clenching. Dull. Sharp.
Sharp.
Okay. All right. All right. So next is your cranial nerve 7, it's your facial expression. So I want you to puff your cheeks. Okay. Smile. Squint your eyes. And show your teeth. Okay, good. So facial nerves are intact. So next thing is the hearing test. So I'm going to include her right ear actually. Okay. And I'm going to say a word.
Cat. Dog.
Okay, good. And then next is her cranial nerve 9 is your glossopharyngeal, and 10 is your vagus. So glossopharyngeal, her voice, she's able to talk, she's able to swallow. Next is the gag reflex, I'm sorry. We're going to use this. Okay. Say ah. Okay, good. It's stuck on our tongue. Okay. All right, good. Next is trapezius. So I'm going to have you turn your head side to side. Okay, up and down. Okay. Now let's put my hand on our shoulder. Now try to shrug. Okay, down again. Try to shrug. Good. So that is good. Next is hypoglossal. I want you to stick out your tongue. Stick out your tongue again. It's symmetric. We're good. And it's midline. All right, so the next is the breast. We're obviously not going to be lifting up her shirt and doing any sort of exam there. So one thing that you would want to do, the easiest way to do it is in a sitting position, arms overhead. A lot of times both hand on the hips, or one arm over, lying down. Each breast you want to look for color and the contour, the shape, symmetry. You want to look for no flattening, no dimpling, no masses or retraction. You want to look for nipple discharge. You want to palpate around the nipple and make sure that everything is okay. And you want to go horizontal and vertical lines palpating all across the breast. Next is axilla. Go ahead and put your arm up. I'm able to feel her axilla with her arms raised on both sides. You want to palpate for any nodules. Okay. And the best way to do this too is in the shower, in a mirror, or usually after your period. So the last one is male and female genitalia. So for female, you should be able to assess with the patient like during a bath or a catheterization, help the patient relax, give the patient a mirror during examination so the patient is able to see the process and what you are doing. Advise the patient you will be touching her genital area, inspect the mons pubis, labium, perineum. inspect the labia minora, clitoris, urethral meatus, and vaginal opening, and you want to look for any ulcerations, inflammation, discharge, swelling, or bruising or nodules. Now for male, you want to inspect the penis for inflammation, note the location of the urethral meatus, inspect for any discharge, inspect the scrotum for any lesions, scars, swelling, or lumps, and inspect the inguinal areas for any erythema or excoriation. And that is the end of your assessment, Melanie. Thank you very much.